Finally, we'll get to failure states of the liver and to the pancreas. When damage has been done to the liver through chronic bouts of hepatitis or other various causes, alcohol or drug related hepatitis, there can be a progression to cirrhosis. And cirrhosis is the development of cirrhotic tissue, which is scar tissue. And this replaces the normal functional tissue of the kidneys with scar tissue. And scar tissue in the body has no functionality. So all of the things that the liver does are not going to be able to be done adequately. So this is irreversible. Scar tissue does not go away in the same way you develop scars on your skin. They don't just disappear one day. They are made out of fibrin, and fibrin is long-standing. It has to be physically removed, which lets you know once there is cirrhosis, the next step is either going to be a liver transplant or progression into liver failure. So the liver progressively scars and it loses its normal functionality because scar tissue replaces those functional cells. So there is something called compensated cirrhosis, where there's enough functional cells left to compensate for the ones lost or damaged. So compensated would have few or even no symptoms in some cases. Decompensated means there's not enough surviving cells to compensate for the loss of the ones that have been killed. And that's where you'll see very serious complications due to cirrhosis. Because you have this cirrhotic tissue, which now has a lot of mass associated with it, replacing the functional tissue, not only do you see this loss of functionality in things like making coagulation factors, putting vitamin K into coagulation factors, um, metabolizing substances, making bile. You'll also see disruptions to flow because now the canaliculi are disrupted and the bile ducts are disrupted from the cirrhotic tissue. The only thing that you can see from the outside really is jaundice. That's why there's a star there. It's a great sign that there is cirrhosis. You'll also see tissue wasting, beginning with fat and then eventually into muscles, coagulation problems, coagulopathies, we call those. And in males, remember, there's not a lot of hormones being utilized. You see feminization of the tissue, so you start to see testicular atrophy. The causes of cirrhosis are either, again, chronic hepatitis or these repeated bouts of hepatitis or chronic drinking. Cirrhosis and chronic alcohol consumption go together very well at high levels. Another sign of cirrhosis is portal hypertension. It's a product. And this happens when the cirrhotic tissue now blocks blood flow through the liver, which remember is going to back up to the portal vein. And the pressure in the portal vein should be minimal, and the pressure in the vena cava, which delivers all of the blood to the heart, should be zero. And if anything in the vena cava raises its pressure above zero, you start to see pressures increased across all of the venous systems in the body. So portal hypertension is high blood pressure in the portal vein that then backs up to the vena cava. You'll see lots and lots of increased pressure in veins, which you can see a lot of the time. So you see these bulging veins in the esophagus. They're called varices. And if they rupture, there's a huge amount of blood that's lost. You see the pressure going so high in these abdominal vessels that the fluid can leak out into the abdomen, causing it to swell. That's called ascites. That's what you see in this individual down here. They have marked ascites. There's also scarring on the stomach that happens because of that. You can see a lot of the systemic veins really just come to the surface, sometimes under a special wavelength of light, and then sometimes under just normal light. The caput medusae is referring to these medusa-like venous structures. The hemorrhoidal vessels, those are veins, so those will start to bulge, so you will see hemorrhoids. So there are a huge amount of difficulties that go along with portal hypertension, and then there should be signs, unfortunately, of liver failure as well, because this means that there is so much damage to the liver and the portal system that we're going to see the liver pretty much on its last legs. Another thing here I just want to draw your attention to bring everything together. Hypersplenism is enlargement of the spleen, which happens in portal hypertension. Remember, the spleen's job is to eat up red blood cells. So you'll see some pretty moderate anemia, neutropenia, and thrombocytopenia. So a lack of neutrophils and a lack of platelets. So not only are they not making coagulation factors appropriately, they also are not making enough platelets. So there will be a lot of coagulopathy in portal hypertension. And again, heavy drinking is a sign of liver failure or predictive of liver failure. And the stages of liver damage from drinking first begin with steatosis, which is a fatty liver. So in cellular injury, we talked about fatty change. That's when fat droplets accumulate in the cell, which can put pressure on the nucleus, the cytoskeleton, and crush it. When that tissue starts to become damaged in that way, it starts to pick up scar tissue, so it becomes fibrotic. So that's liver fibrosis, which then forms its own interconnected web of connective scar tissue that destroys the functional cells. So in fibrosis, there is scar tissue, but the functional cells still exist. In cirrhosis, we now have all of those scar tissue pieces in each lobule connected together by more scar tissue. 15% of alcoholics become cirrhotic after 10 years of high alcohol intake. High levels of those free metabolites, those free radicals, reactive oxygen species that build up, those damage the liver as well as the brain and other tissues. You see this fatty degeneration, free radicals. The liver starts to atrophy, it scars, and its function goes down, and its size goes down because its function is going down. This is exaggerated by binges. It's actually healthier for the body because we love homeostasis. If people are drinking really heavily every day, it's actually easier on the brain and liver than if they drink heavily every so often, because the body then has to go through withdrawal and try to fix the effects of that heavy drinking, and then a new binge is reinstated. So binges are very deleterious to the health of the body. Hepatic failure and death is common. There is something called telescoping in women, where women, we don't know why this happens. There's lots of groups studying it. I was one of them who was very interested in this. Like, why are women so affected by alcohol? And they're affected so much sooner by drinking much less. We see cirrhosis in alcoholic men usually between the ages of 40 and 65, women between the ages of 30 and 45. And that's with having drunk the same amount of time. Women get it a lot earlier, and women also drink less overall than men. So there's greater effects, and we see them more pronounced, and we see them sooner. So we call that telescoping, and we're not really sure why that happens, but it is something that's a reality. We see the same effects in the brain. Diagnostic tests, again, you can see jaundice, but how do you confirm what's going on and your suspicions? So blood and urine tests, looking for bilirubin in the serum, doing blood tests, and then looking in the urine for conjugated bilirubin. So how much is there versus how much should be there. Imaging can show you the location of hepatic tumors. Ultrasounds are a good way to visualize gallstones. There's also a needle biopsy that can get to the liver. It's a rather large needle. Patients are put on their side. They're asked to picture laying on your left side and then putting your right arm up over your head so that your right elbow is sticking up, your right palm's the back of your head. Now what you've done is separated the ribs a little bit and brought them off of the liver, bringing some of the liver into accessibility range for a needle biopsy. So this can be done through the abdomen to sample the tissue to see if it's truly cirrhotic or cancerous. When you get to an irreversible condition like cirrhosis, patients sign up for a transplant. A liver transplant can be done from a live donor, which is pretty cool because your liver is so good at regenerating that you can donate a portion of the liver. So in this case, this recipient's liver was removed, and then they receive a lobe from a donor individual. And then hopefully that transplant is successful. They are not always successful, but they do their best in matching patients and altering lifestyles to be sure that they're not going to suffer further liver damage or have an immediate reaction to the donor graft. And then just finishing with the pancreas, there's two things that can go wrong with the pancreas, just strictly speaking right now, for simplicity's sake. The pancreas has a lot of jobs. It's endocrine, it's exocrine, it's making juices, it's doing all kinds of things. It has a tail, it has a head portion. When you see problems, they're almost always in the head portion, and that's because this is the portion closest to the exterior of the body, which would be the duodenum. We consider that exterior or outside of the body. So when there are issues with cancer or swelling, it's generally at the head of the pancreas. And the two things we'll talk about are just cancer of the pancreas and inflammation of the pancreas. And what I want you to remember is there's this duct flowing through the pancreas, and it converges with the common bile duct to make this ampulla of Vater controlled by the sphincter of Oddi. So you don't see a lot of these problems in the tail. Eventually the tail can become affected, but almost always you'll see that the head of the pancreas is what is going to be affected. Okay, so things that can affect the pancreas. The first is swelling, so that's called pancreatitis, which can either be acute or chronic. So acute pancreatitis is associated with a lot of things. Most primarily, like I had it labeled, alcoholic swelling of the liver. When there's alcoholic swelling of the liver, it swells so much that the duct of the pancreas is obstructed, which causes damage. This can also be a case where there's a gallstone that's lodged or a tumor that's lodged and obstructed the pancreatic duct. The big problem with this is that one of the pancreatic enzymes called trypsin, it's a pancreatic juice, trypsin. Trypsin is an enzyme that digests proteins. Your organs are proteins. So if we have this, here's a pancreas, and there's this duct going through it that all these juices, including trypsin, need to flow through. If there is a blockage here, either because the liver has swollen or there's a tumor, now those juices cannot get out of the pancreas. Now they're stuck in there. That trypsin will start to digest the pancreas itself, which is very, very dangerous. And when that ruptures, that leads to death almost immediately. This can also happen when there's a block of blood flow or infection around the pancreas, a trauma to that area, or it's damaged by excessive use of drugs like alcohol, or what else? Like cigarette smoking, for example, can limit pancreatic activity. So that can cause damage of those cells, which still releases those enzymes, the most important being trypsin. So we want trypsin to leave the pancreas, go into the duodenum, and digest proteins like it's meant to. If anything traps it in there, then the protein that's digested is the pancreas itself. So acute pancreatitis is just a sharp instance of swelling of the pancreas. But every time somebody goes through acute pancreatitis, there's more and more damage that's done. It doesn't regenerate at the level the liver does. So when there's release of trypsin and pancreatic enzymes, again, this is something that's really, really dangerous. There's inadequate absorption, that's called pancreatic insufficiency. So there's malodorous stools, oily, difficult to flush. When the pancreatic parenchymal or physical cells, like the active cells, are damaged, they also undergo that fatty change. There's low levels of calcium in the blood. Muscles become hyperactive. You get cramping. You get eventually prolonged sustained contraction. The vessels are damaged. They bleed. You go into shock. And then there's inflammation. There's exudate. There's low blood pressure. You go into shock. It's all very, very dangerous. When also this happens, this affects the blood flow of the body so that these pancreatic enzymes like trypsin goes to the lungs. And now your lungs start to get digested. And when other things are in your alveoli besides air, that's referred to as acute respiratory distress syndrome, which is a 50-50 chance of mortality from that. So trypsin is only good in your intestines to digest proteins. We don't want it going to the lungs. We definitely don't want it stuck in the pancreas. That causes huge amounts of damage to the tissue and failure. So once you see that damage, that's really dangerous. So just to finish that up, like chronic pancreatitis would be chronic just liver inflammation caused by hepatitis, so heavy bouts of drinking all of the time. Or just repeated bouts of acute pancreatitis increase the chances of these bad effects. With pancreatic cancer, like I mentioned before, the problem is that the tumor almost always starts in the head of the pancreas, and that it blocks the trypsin in there, and then it starts to digest the pancreas itself. So it's very dangerous. Life expectancies from chronic or bouts of really bad acute pancreatitis or chronic pancreatitis or pancreatic cancer are not very good. There are some experimental treatments out right now, but it is a very deadly type of disorder. We need our pancreas. Okay, so this is a very straightforward sample exam question. Female client has just been diagnosed with hepatitis A, asks, how could I have gotten this disease? What is the nurse's best response? You may have eaten contaminated restaurant food. You could have gotten it by using IV drugs. You must have received an infected blood transfusion, or you probably got it from engaging in unprotected sex. So let me show you a way to chunk these answers together. IV drugs, infected blood transfusion. Those are both cases that involve a needle going into a vessel bringing hepatitis. Those two would essentially be the same answer, so you could get rid of both of these. And remember, if it's transmitted by blood, then it's also transmitted by unprotected sexual intercourse, because there needs to be some tearing and sharing of blood in order for things to be passed along. So these we can actually chunk together. They all are the same type of transmission generally, whereas the only one that's different is the restaurant food one, and that should be your correct answer. All right, people, enjoy.